Decaf. Oh, hey, Dr. Amy here. We are back. We are stuck in the FPT podcast studio, i.e. the closet. Welcome. Salut. Got my Superman cup here today, which is fantastic. So when I put my warm drink in, Clark Kent disappears and he turns into Superman. I love it. A patient got me this a while back, but I have the Nespresso decaf that's in here. Kind of spilled a little bit. Oh, okay, there we go. But we are coming at you live from the closet. This coffee talk is going to be a good one. This is a dry needle. Should I dry needle because I have a symptom? Oh, baby. Or should I actually come see physio for an actual skilled PT session? Do I need a true assessment? I think I need dry needling. So I had a patient experience this past week. I'm going to leave this in here. I had a patient experience this week. Haven't seen her for a while. Tweaked her neck and she kind of got this like pain in between her shoulder blade and her spine. This area of what I call the gutter. So when she messaged me over the weekend, I responded to her Sunday evening this past week, and she said, I think dry needling will help with this. I'm like, okay, well, what is it? You know, I didn't go in depth. I said, okay, well, let's get on the schedule. I'll see you. Saw her on Monday. I did a little quick assessment. I usually do when patients still just kind of request dry needling. Yeah, the needle's still in my arm, and I'm moving my arm. I can do this because I'm a PT. Okay, I suggest patients not do this. And as I was assessing her, I was thinking to myself and even educated her. I'm like, listen, I think we need to investigate a little bit deeper into this. I think this might be coming from your neck. And she was very, unfortunately, adamant about getting dry needling because she's had a positive experience with dry needling in the past, which is great. So I think sometimes from a clinician standpoint, we know what patients need in order to get better. But sometimes we have to give patients what they want. So I gave her what she wanted. She wanted dry needling into that area. After I did a very quick assessment, as I feel it may perhaps be stemming from her neck and she's getting symptoms into that gutter area in between her shoulder blade and spine, because there's a lot of referral patterns that can happen from the neck that go to that area. And just based on when she was experiencing those symptoms, she was performing a lot of kind of pushing motions in a CrossFit class and some other functional fitness. So despite a lot of education in this case, I've had a major history with this particular patient, and every time I've heavily exposed a lot of education on top of this. Dry needling, I'll say right now, does not solve an issue that could be stemming elsewhere. I'll say that again. Dry needling does not solve an issue that might be stemming elsewhere. Dry needling can help with some symptom reduction. Dry needling can also help with decreasing pain signals, and dry needling can help with recovery, which I love to use that for. And dry needling can also help with kind of diagnostic application. I'll use that sometimes coming from the PT perspective, but in this case, when I saw the patient yesterday, just in passing, after she completed her fitness, she said, nothing has changed. And I'm like, well, we should probably get back into the clinic next week and really thorough reassess this and dig a little bit deeper, perhaps look up to the neck. And then she kind of looked at me and was thinking, I could tell, a face like, yeah, you're probably right. So I guess the concept of this coffee talk is not only based on patient experience that she's had success with dry needling in the past, this particular issue, dry needling was not the case or the route that we needed to truly walk down. She needed an actual assessment, and she needs an actual assessment. And this particular patient needs to come in for physio every so often, because what is relayed to this particular patient, she needs reinforcement of that. It's hard for her to make that connection. And we'll get patients like that. I'm sure there's a lot of physios. If you're listening to this, thanks for listening. You can relate. We can own and pound and educate as much as possible, but if we can't bridge that gap, what's the thing that's coming from us that's missing in order to keep that patient committed and understanding what's going on? That's where I need to get only personally better with that. So, in this case, dry needling didn't help this particular patient. So we need to get back to the basics. She actually needs to come in for an actual skilled physiotherapy session so we can really understand how these symptoms are acting on a daily basis, as well as what she's doing outside of fitness. Because she actually took 2 weeks off and did nothing. Thought she couldn't come to the gym. We have pretty good coaches, I'm not going to lie, at CrossFit Pineville that know what they're doing because we have a good communication aspect. I'm right there on the floor. My office is right there. So our coaches know how to modify things. So if this kind of sounds like you and you feel like you just need a passive modality, when in reality, when you're coming to seek out professional help, perhaps that professional needs to do their job. But sometimes, in order for patients to understand what's going on, you have to give them what they want. Because we know the next time they see us, we're going to give them what they actually need. So, Salut, Superman. It's getting colder, because that's colder. But, thanks for hanging in there, and enjoy that coffee. Don't poo-poo on decaf.